Hey guys, welcome to another video. I'm going to be starting a new series called School Psych Grad Lounge, where I have discussions and interviews with other grad students in school psychology programs, where we will answer your questions and kind of have a discussion about the field or about grad school. So if you have any burning questions or things that you want to know, make sure you leave them down in the comments below. Don't forget to like and subscribe, and I'll see you guys later. Enjoy. Bye.
Hi everyone, my name's Brad Davis. I'm a second-year graduate student at Miami of Ohio, which is near Cincinnati, if you're familiar with it. I'm originally from Pittsburgh, and I'm gearing up for my internship for my third year in school psychology graduate program.
Yay! Alright. Well, thanks so much for being here. I'm so excited to get to know more about your program and your experiences, and it'll be great conversation.
Yeah, Tiffany, I'm happy to be here. I've been a fan for a while, so I'm excited to talk about school psychology with you.
All right, so a lot of people always ask how do you make yourself more competitive for school psychology graduate programs? They always ask what can I do in undergrad to make my application better or to get into a program? And if you have any tips or thoughts or maybe some experiences that you can share, that would be awesome.
Yeah, and Tiffany, I completely agree. I think from my experience as well, every undergraduate I've talked to kind of stresses over finding that perfect application materials. And my best advice is to be enthusiastic about the program you're applying to, be authentic. And then also I've noticed a lot of students get held up on GRE scores, and most programs require it, and of course it's a stressful thing and they're important, but for most programs it's really only one part. And in my experience, and after interviewing some applicants that are applying, for example, this year, I think my best advice would be, to find leadership opportunities outside of, class, to volunteer as much as you can, to reach out to the program directors and show that you did your research on the program, and kind of, demonstrate that through just speaking with them and just, showing interest, yeah.
I think that's a really important one, the thing that you talked about last, having interest in that specific program, and then, coming in knowing something about it, because a lot of times during interviews they ask, why do you want to come to this school? And you have to have an answer.
Yeah, right. I know, and we really can't stress that enough, that doing your research on the program, there's nothing more important than knowing the program inside and out and understanding why this makes this program better than the others and why you'd rather be here.
Yeah. So you mentioned volunteer experiences and jobs and things like that. Do you think it has to specifically be related to the field or working with kids, or can it just be any kind of volunteer experience?
Yeah, that's a good question too. I think both are beneficial, right? Of course, it's great to see related volunteer experience within, working with children with disabilities, whatever it might be. Of course, that's great. But I think it's just as valuable to show that you're interested in volunteering and giving back to community in other areas besides, a school psychology field. So I wouldn't say you only have to think of it in regards to education, but I think just finding situations where you feel that you can provide some kind of benefit. Mm-hmm.
That's a good answer. Was there any specific job or volunteer thing that you did in undergrad that you think helped you build your resume or build experiences? Yeah,
I would say for me, I did some volunteering outside, working with high schoolers, where we did a few mission trips, and that was great. But more in just a personal situation, I just enjoyed that, and it was fulfilling for me. And then in regards to really specific school psychology volunteer options, this was an internship I had in undergrad where I worked with the Cleveland Clinic at a summer treatment program. So we worked with kids that primarily had ADHD and autism spectrum disorder, and we worked with them trying to, shape behaviors and help them throughout, just trying to clarify what's appropriate and what isn't appropriate, and just working with them every day for the whole summer. That kind of solidified my interest in school psychology and solidified my interest in working with children, especially that had learning disabilities, especially. So I would recommend that program to anyone who's even remotely interested in the field.
Like, get your feet wet. I feel like a lot of times, like, you have to know you want to do it before jumping into the program, and getting those experiences helps you, like, make that decision.
Yes, absolutely. And that's a great point. Rather than just applying because you think that this could go for any graduate school, but just because you think it might be a good career, try it out, right? You want to try similar experiences, similar volunteer options to make sure that you are interested in this field and there's a spot for you.
Yeah, for sure. All right. I think that's some really good advice. Hope people are listening.
You too.
Let's see. What do you enjoy most about school psychology so far as a graduate student? From like the things you've learned or the things you've experienced, like what draws you to the field, or why are you still in it?
Yeah, why am I still in it? Good question. So I think when researching school psychology and when meeting school psychologists before actually entering my graduate program, I heard that this field requires you to put on a lot of different hats, right? And at the time I understood what they meant, but I didn't really I didn't feel that yet because I wasn't doing anything besides researching it. And now, as I've done practicum and I've gone through almost 2 years of schoolwork and getting ready for internship, I completely see how true that is. And I love that as a school psychologist, your role can look drastically different depending on the need of the students and then what your school places emphasis on. So if it's assessment heavy and you love assessment, that could be a great fit for you. But if you're looking for more emphasis on counseling, there's an opportunity for you. So I love that we can kind of pick and choose how we make a difference within the school. And that's my favorite part of school psychology. It's such a diverse field and there's such a need for school psychologists. So yeah. What about you?
That's a good point. Oh, for me, so I do like that aspect as well. Like, I feel like we have to be flexible, but like the job can also be flexible because we have so many options. And like, I'm not one to like sit still and like do the same thing every day. I think I get bored really easily. And so like you have like different levels of schooling that you can work with, or you can really focus on like different areas, and that's really exciting. I also do like the research aspect of things, and I just love like working with kids and like watching them succeed, and like to be like even a little part of that is like really rewarding and it's exciting. So yeah,
I completely agree. And going back to your first question, what you just mentioned reminded me that depending on what level of program you're interested, whether it's doctoral or master's or specialist level, I think that should also shape how you prepare, right? So if you're looking for a PhD program for school psychology, you should know that program is probably going to be more research oriented, and you want to identify professors that are a good fit for you and identify research interests. So I think we want to mention that is definitely, there should be emphasis on research if you're looking for a PhD program.
And those programs also want you to do research or do that in undergrad and have some kind of experience in that field. Yeah,
absolutely. And that's valued much heavier in a PhD realm. I'm not saying it's not in EDS, but it's definitely more important.
How did you choose your program? I get that question all the time, but I feel like I can't give the best answer because I only applied to one program, and it was just like out of convenience. Plus, they're known to be like really good with just as a training clinic, because we have a clinic where we can work with children and have paying clients. And I'm thankful I got in and I'm in the program now, but I can't really talk about how I came to decide on, the program itself, because I didn't really go through that experience.
Yeah. So deciding a program was like 1 year of stress for me, where I was only thinking about that. Of course, I was, finishing up undergrad. But, so I applied to 10 programs, all specialists. Personally, I wish I would have threw in some doctoral degrees as well. I used the interview to get a better feel of how one program felt from the other, where I felt comfortable, where I felt I could have like the most opportunity to grow and like have different opportunities. So it really came down to where I felt valued and how dedicated were the professors, etc. There's a lot that went into it, but overall, whenever I left Miami University, for example, I felt phenomenal about the program, and I was lucky enough to get an offer, so I was more than happy to accept.
Awesome. I always do tell people, like, when you go on interviews, like, you're interviewing the school as well, and like if you have any kind of like special connection with any of like the faculty members, that's really, really valuable. But I think other things that are heavily weighed are like tuition and location. I mean, those things are important as well.
Yeah,
So
absolutely.
it's really tough, I'm sure. Like it's stressful.
Yeah, well, it's incredibly stressful, and that's a great point. You want to look at the school holistically, think of a bunch of different factors, but I can't stress, I mean, you're working with professors all the time. And then I think it's also important to reach out to current students and kind of talk to them and just see what their experience has been like, because they will be able to describe the program better than anyone else, probably.
Were you able to meet some of the current students or interns while you were there for any of the interviews?
Yeah, so for most of my interviews, the students were able to help us through or walk us through the program, give us tours whenever we weren't interviewing with professors. So I used that most of the time, where I was able to like ask questions I didn't feel as comfortable asking professors. And then I try to get most of their emails so I could just reach out to them and ask like follow-up questions that, again, I might not ask professors. So the students kind of give a good insight of what this program might be like and what to expect. So always try to reach out to them in a professional way.
Yeah, for sure. It's like they're still sort of interviewing you, but it's going to be more raw. Like they're in it, and they might give you more honest answers. You don't know that.
Yeah, absolutely.
Awesome. Let's talk about our training programs and how they might be similar or how they might differ. And I want to start off with like assessment. How do they train you to like do cognitive assessments, or do they like train you in achievement and all of that, like going through, I guess, like the eligibility process in the schools, etc.?
Yeah, so we both know, I think, that depending on the program, this can look quite different. But at least for my program, we started learning cognitive assessment spring of my first year. So we had the first semester fall where we talked about RTI and MTSS as a broad concept, and we talked about FBAs and what those look like and how to assess a student holistically. But once we got to spring, we had our cognitive assessment course, which was great. It was a long course in regards to like the length of time. So it was like once a week, but it was from like 3 to 8 p.m. So we spent a long time working together.
Class.
Oh, I know. And it's tough to put that class in a shorter time span because there's so much to talk about with the cognitive assessment. But within that, we would, learn them, obviously, and then we would go out, I think we had 4 different students where we had to videotape. And again, this could differ.
Okay.
Tiffany, I think you might mention you might have had more students. So we did that in the spring, and then we followed that up with this past fall of my second year. We did achievement.
Okay.
So we've primarily focused on the WJ and the Wyatt for achievement. But it was the same idea, a long class, use different students that we can videotape and practice the assessments on. Yeah, so what about you? How did this differ from yours?
So it actually sounds like sort of similar, but like also very different. We had a cognitive assessment class our first semester where we learned the different assessments. I think we did 8 different ones, a lot of similar ones like WISC, the DOS, we did Stanford Binet, KAC, all of those. And we had to record the WISC once, but we had to administer the rest of them to children, and then we'll get our protocols checked.
Right.
Yeah, and we had to do the WISC twice, once recorded, once not. Yeah, and I don't know if it was like the same for you guys, but like our first WISC took forever because we're like still like learning the manual and like looking through everything and like waiting for the child to respond. Like you have all day.
Yes, they're, oh goodness, those were hour long or multiple hours, and then scoring them and just getting used to doing a full evaluation of what that even looked like.
Like what does it
learning
mean?
the ropes a little
yes. For sure. So that was one semester, and then our second semester we have something called the cognitive assessment program where we'll assess students, and typically it's for like private school or our like gifted and talented program in the area. It's called AAP, so it's Advanced Academic Program, and so a lot of parents will come in for that testing, and so we'll have to do 5 clients throughout the semester, and that's part of our training. So we'll have a supervisor, they'll help us with like the intake interview, and then we'll do the assessment, write up the report. Like it goes back and forth between your supervisor, so you know how to do your report writing, and then you'll have the feedback with a parent. And so that was like a great stepping stone because it's only cognitive, so you'll like only be doing the WISC or you'll only be doing the DOS, and it's like not too overwhelming.
Right. Yeah, I've talked to a few different people who have clinics near or at their campus, and it just sounds like such a beneficial thing to consider when deciding programs, and it just depends on the program if they have the opportunity to have that. But from everyone I've talked to, I've only heard good things about being able to collaborate with a clinic.
Yeah, I mean, I think that's like something I'm really, really thankful for. And then this full year we've been doing comprehensive assessments, so we'll take a client and then go from like A to Z, but it's like clinical, and so we'll like give the diagnosis and all of that, and it's like hours and hours of like testing and hours of report writing. So yeah, we're still like in the midst of it, and now we're in the schools doing the same thing. Right.
So tell me about your practicum experience and what that looks like.
So we've been in practicum like since our first semester. Our first semester was full just shadowing because we don't know anything, and so we'll go in, we'll have some like questions that we're supposed to ask and bring back to like our school, like our discussion class. So we might like learn about RTI, MTSS, and like how eligibility works, and so that was really cool to like just be in the school. And then we have like an intervention practicum where we'll go like do counseling groups or like help with interventions. And that really looked different for everyone, because if you're in a high school, that's going to be very different from being in an elementary school and doing like, I don't know, like red light, green light counseling versus like mindfulness for, high schoolers with anxiety. And this semester we're doing testing, and so we'll help with the testing process and we'll help write the report, and that's pretty much it. What about you?
Yeah, so pretty similar, but again a little different. So our first semester we did observation hours, but those were primarily working with people who weren't just school psychologists. We're working with speech paths, occupational therapists, physical therapists, whatever they might be, just different roles within the school. And then my fall semester, second year, again, it was the same thing, but a little more hands-on. And then right now, my spring semester, my second year, we have 2 practicums, one mental health based and then one school psych based.
Okay.
So mental health is primarily working with counseling and running different groups and individual counseling. And then my school psych is what it sounds like, just a bunch of different putting interventions in place, and then we're doing some assessment testing as well. So similar but a little different.
Is the mental health one like in like a different clinic, or is it still in the school setting?
So they're 2 different schools. So my mental health one is at an all-boys Catholic high school. Okay. And then, so drastically different from my school psych one, which is at an elementary school. But they're both great. I'm happy to, be applying what we've talked about for the last 2 years, and then, just being in school and working with a school psych one-on-one. It's nice.
Yeah, it's like definitely different when you're like learning things in your classes and then being in the schools and like seeing it all being like played out. Yeah.
Yeah, I think we are all kind of, itching and getting ready for practicum because, of course, classes are important. Understanding the information is important, but once we can start to apply it, I think so much learning can occur.
All right.
Okay.
I had like a quick question about counseling. How do they train you in counseling?
Yeah, so we, of course, we talk about counseling slightly within our first year, and then our second year in the fall, we have a counseling class where we work on individual counseling and group counseling, and throughout that class we kind of develop groups that we'll work with between our cohort, and we kind of just we use that, and then in the spring currently we take all the skills we learned in the fall from the counseling class and then use those for our cases for our mental health practicum.
Gotcha.
So there's an emphasis on it, but sometimes I wish there was more counseling, but some programs also don't have any counseling classes, so it just depends on the program and what that looks like. What about you?
We only have 2 counseling classes. One was like just theory based. We're in one now where we're supposed to apply those theories, but we do like a lot of role play with our classmates, and we'll have to like record like a 20-30 minute session, like transcribe it, and then like write out like which skills were used. I honestly don't feel like super comfortable with counseling yet because we're not counselors, but I know it's like part of our role and what we're expected to do in schools. And so I wish there was like a little bit more training, or like I wish we did it more in the schools as well during practicum, because we're doing a lot of assessment, report writing, things like that. But hopefully it'll just like, you'll build those skills as you're in the school. I don't know.
Yeah, I think I can speak for at least my cohort, and we agree that some of us feel underprepared for counseling, but of course we're doing, educational related counseling and making sure that's our role. But I do think there's still a ton to learn once we actually start internship and post-internship once we really start. I agree.
Yeah, well, we should do this again. Like once we start internship, we'll have so much more to talk about, and like our like differing experiences, like in our different states, and yeah, if we do a follow-up during internship, that'll be phenomenal, and we can kind of laugh at how naive we were. We don't know counseling.
Yeah, right. Yeah, the reality of it. Yeah.
All right. Well, thanks so much for coming on here and chatting with me. This was awesome, like super eye-opening even for me. So.
No, Tiffany, I had a great time, and like I said, it was great to finally meet you.